So we see the transformation stories of our patients. We see the before and after pictures. It's very dramatic and amazing and incredible to be a part of. But when you're talking about medical providers and healthcare structures, what is hope for them?
The USNS Mercy, a hospital ship, originally built to save the lives of U.S. troops wounded in combat, but also capable of serving more than 1,000 patients with various medical needs.
It was originally the SS Worth, an oil tanker, and it was converted by NASSCO here in San Diego in 1987 from a tanker to a hospital ship, because the Navy needed a ship that size to have the capability to support the various missions it would be expected to perform.
These ships were converted to hospitals with the goal of helping thousands of needy patients. They have traveled around the world to address the Global South's healthcare problems. But are the ships helping to improve the overall well-being of its patients?
This is obviously a huge ship. It's known for its medical capabilities. Is there anything that you guys can't do on the ship? It sounds like just about everything.
Well, you know, from a surgical standpoint, we can do everything except for transplants and open heart surgery in terms of bypass. But we have dialysis capabilities. We've got all of the surgical specialties covered, everything from neurosurgery to oral surgery, urology. We've even done 8 deliveries on the ship and had 9 babies. Yeah, so one set of twins.
You have patients on the ship, such as patients with spinal cord injuries, patients with brain injuries, kids. Yeah. It would be impossible for them to go back to Haiti and live there. The resources aren't there. On the other hand, they're not necessarily in a life-threatening condition. What happens to those patients?
Yeah, I mean, that's a great question. Right now we've got about 15 people with spinal cord injuries, and we have another 6 who have incomplete spinal cord injuries. So we're trying to figure out where's the best place to take care of them.
When addressing the health concerns of its patients, these ships travel worldwide to the Pacific, Africa, and the Caribbean. But do these ships address the specific healthcare needs of these nations?
We visited 5 countries, including the Philippines, Vietnam, Timor-Leste, Papua New Guinea, and Federated States of Micronesia, just to provide health care and engineering for nations that needed our help.
The ship was on a 4-month mission to provide medical care to countries throughout Latin America. But from the very beginning, it was designed as essentially a public relations tour, and they make no secret of the fact that they designed this mission to be able to bring medical care in a very visible way into these 12 countries.
These ships tend to thousands of patients daily. However, they have a finite number of resources such as beds, nurses, doctors, and surgeons. Are the ships utilizing these limited resources to the best of their ability?
The key is going to be folks here on the ground sending the right patients out to that ship, because if they get somebody out there with, say, like a broken finger, that patient's going to be tying up space until they can get them an airlift back here. The Comfort has about 1,000 beds, nearly as many as Johns Hopkins, but at some point soon, they'll all be filled.
Well, but of course, it's one thing to say you have 1,000 beds, but the key is how you staff it. We don't really staff this at 1,000-bed capacity, and frequently we'll staff it maybe at a 250-bed capacity. We have a couple of utility boats that we've nicknamed Band-Aid 1 and Band-Aid 2, and they were used to transport all of the patients and the staff between the shore and the ship.
Most people would say the ship's greatest capability is its surgical capability. That was used somewhat on a limited basis because the ship couldn't get close into ports to get enough patients on and off. But they learned very quickly that using this large 900-foot ship to get people ashore every day was not a very efficient means. Quite often the people had to spend 4 hours a day on boats, helicopters, buses, getting back and forth to sites and really limiting the amount of time they had to take care of patients.
There is much debate over the implementation of these ships and to what degree they are helping address developing nations' huge public health concerns. However, this raises the question, is there a need to reevaluate the policies that could help Mercy-class ships address broader health concerns of these developing nations?
A case like this is very complicated, and you can't just show up for a 2-week mission and do a surgery and then leave. You have to have a whole system in place that's going to support this. Once you start showing that you care, these countries warm up and are very happy that we're there, and they want us to come back. And I think that by us continuing to support them and their efforts, we will improve the relationship of the United States in the world and make this world a much better place for all of us.